Hello, in this video I'll be having a conversation with Sister Callista Roy about her adaptation model. Hello Sister Callista, my name is Dhwani. It is an honor to meet you and thank you for taking the time to join me for lunch. How are you doing today?
Hello Dhwani, I'm doing well, thank you. It's my pleasure to join you.
I'm glad to hear that you're doing well. The reason I invited you to lunch is to talk about the impact your adaptation model has on my nursing practice as a transitional care coordinator, or TCC. In this role, I closely collaborate with my patients, their families, and the healthcare team during critical transitions between healthcare settings, such as from hospital to home or to a rehabilitation center. I often encounter challenges such as insufficient resources, time constraints, patient and family readiness concerns, financial barriers, cultural differences, care setting transitions, and legal matters when planning patient discharges. To tackle these challenges, I apply a holistic approach rooted in your model to ensure each patient's transition is personalized and successful.
That's wonderful to hear, Dhwani. Transitional care is such a pivotal time for patients as they navigate changes in their health and environment. As you may already be aware, the Roy adaptation model, which I developed in 1976, is a nursing theory that focuses on individuals as adaptive systems. The four components include adaptive modes, which focuses on physiological, self-concept, role function, and interdependence modes. The second is stimuli, which refers to internal and external environments that invoke responses in individuals. Moving along, the third focus is on adaptive responses, which are actions taken by individuals in response to stimuli, aimed at maintaining adaptation. Finally, the last component is the nursing process, which encompasses assessment, nursing diagnosis, goal setting, intervention, and evaluation, tailored to enhance adaptation.
I've noted down a list of questions I wanted to ask you in regards to my practice as a discharge coordinator, hoping you can provide me with some insight and clarity.
Yes, of course. I am happy to hear your question. Go ahead.
My first question is, how does your adaptation model reconcile the tension between standardized clinical protocols and personalized client-centered care in discharge planning? This question is essential to understand how your model guides nurses in balancing standardized protocols with personalized patient-centered care during discharge planning. My second question is, in what ways does the model challenge traditional hierarchical structures within healthcare, particularly in empowering clients as active participants in their own discharge planning? This question is important as it explores how your model challenges traditional healthcare hierarchies by empowering clients in their discharge planning. Traditionally, decision-making and authority were predominantly held by healthcare professionals such as doctors and nurses, with patients having a more passive role in their own care. Asking this question provides insight into how this model helps in collaborative decision-making and personalized care, promoting patient autonomy and ultimately improving health outcomes. My third question is, can you discuss the ethical implications of using the adaptation model to prioritize client adaptation needs, especially when faced with resource constraints and time pressures in discharge planning? I understand that this model provides a holistic framework for coordinating patient discharges, assessing needs across biopsychosocial dimensions to develop tailored discharge plans. However, its thorough approach may demand substantial time and resources in a fast-paced healthcare setting, which prompts questions about the ethical implications of using this model. The fourth question that I have is, how does the adaptation model address the inherent uncertainty and unpredictability in client outcomes post-discharge, and what strategies can nurses employ to navigate these challenges? This question is crucial because it addresses the reality that healthcare outcomes post-discharge are often uncertain and unpredictable. Understanding this helps nurses gain insight and develop strategies to assess and support patients' adaptive responses, enhancing their ability to manage unpredictability effectively and promote optimal post-discharge outcomes. Lastly, from a philosophical standpoint, how does the adaptation model contribute to the broader discourse on nursing as a profession that balances scientific rigor with humanistic care, particularly in the context of client transitions between care settings? This question is important to ask as it explores how your model shapes nursing's philosophical stance, balancing scientific rigor with humanistic care as clients shift across different care settings. Understanding this helps define nursing as a profession that integrates empirical evidence with compassionate, personalized care. This is crucial for ensuring continuity and quality of care across healthcare settings.
Thank you for your questions, Dhwani. Your questions delve into the theoretical underpinnings, ethical considerations, practical challenges, and broader implications of applying the adaptation model to discharge planning.
Thank you, Sister Callista. I will continue to do my best to uphold the principles of your model and advocate for the best possible outcomes for my patients.